Okay, so today we're going to finish talking about the endocrine system. So for adrenal glands, we have learning outcomes to list the hormones produced by the adrenal medulla, adrenal cortex, provide a function for each, explain how the adrenal cortex is involved in the stress response, and distinguish between mineralocorticoid and glucocorticoid hormones. So the adrenal glands sit atop the kidneys, and each consists of an inner portion called the adrenal medulla and an outer adrenal cortex. Parts of the cortex are under the control of corticotropin releasing hormone, or CRH, from the hypothalamus, and ACTH from the anterior pituitary. So the adrenal glands, again, sits atop of the kidney. We have the adrenal cortex and the adrenal medulla. So the adrenal medulla is the hypothalamus and signals that travel through preganglionic sympathetic nerve fibers to the adrenal medulla to stimulate it to secrete its hormones. Epinephrine, which is adrenaline, and norepinephrine, noradrenaline, bring about changes that occur during a flight or flight response, a short-term response to stress. So summer stress responses for short-term are heartbeat and blood pressure increase, blood glucose levels rise, and muscles become energized. So adrenal cortex can be divided into three regions: the zona glomerulosa, the zona fasciculata, and the zona reticularis. Hormones produced provide a long-term response to stress. Major types of hormones produced by the adrenal cortex are glucocorticoids and mineralocorticoids. They also secrete a small amount of male and female sex hormones in both sexes. Okay. Long-term stress response are glucocorticoids. So protein and fat metabolism occur instead of glucose breakdown. Reduction of inflammation, immune cells are suppressed. And mineralocorticoids are sodium ions and water are reabsorbed by a kidney, and the blood volume and pressure increases. So glucocorticoids secretion is controlled by ACTH. They regulate carbohydrate, protein, and fat metabolism. Cortisol is a glucocorticoid that is active in the stress response and the repair of damaged tissue. Glucocorticoids raise the blood glucose levels in two ways. They promote the breakdown of muscle proteins to amino acids, which are taken up by the liver. They promote the metabolism of fatty acids rather than carbohydrates, so this spares glucose. Cortisone and other glucocorticoids can relieve swelling and pain from inflammation. However, by suppressing pain and immunity, they can also make a person highly susceptible to injury and infection. So mineralocorticoids regulate ion balance in the body, and they're produced by the zona glomerulosa of the cortex. Aldosterone is the most important. This targets the kidney, where it promotes absorption of sodium ions and excretion of potassium ions. So renin is secreted by the kidneys when blood sodium levels are and blood pressure are low. Renin is the enzyme that converts the plasma protein angiotensinogen to angiotensin 1. Angiotensin 1 is changed to angiotensin 2 by a converting enzyme in lung capillaries. Angiotensin 2 stimulates the adrenal cortex to release aldosterone. So mineralocorticoids concluded. Renin-angiotensin-aldosterone system raises blood pressure in two ways. Angiotensin 2 constricts areolas. Aldosterone causes the kidney to reabsorb sodium. This causes water to enter the blood, increasing blood pressure. So atrial natriuretic hormone, or ANH, is released by stretched cardiac cells after an increase in blood volume, inhibits the secretion of aldosterone from the adrenal cortex, causes natriuresis, the excretion of sodium ions. When sodium ions are excreted, so is water. Therefore, blood pressure lowers to normal. Okay, so high blood sodium, the heart secretes atrial natriuretic hormone into the blood, or ANH. And ANH causes the kidney to excrete sodium and water in urine, and this causes blood pressure to drop. Okay, on the other hand, if you have low blood pressure, kidneys secrete renin into blood. Renin causes angiotensin 1 and 2. Adrenal cortex secretes aldosterone into blood. and aldosterone causes the kidneys to reabsorb sodium and water from kidney tubules, and blood pressure rises. So sex steroids, in addition to glucocorticoids, the zona fasciculata and zona reticularis secrete small amounts of sex hormones called gonadocorticoids. These include male hormones like androgens and female sex hormones estrogen. The primary androgen is DHEA. In addition, it produces small amounts of estradiol, which is a form of estrogen. Although in females, most estrogen is produced by the ovaries, adrenal estradiol does play an important role in regulating growth of the skeleton in puberty and maintaining bone mass. So malfunction of the adrenal cortex can cause Addison disease, which is hyposecretion of glucocorticoids. The presence of excessive but ineffective ACTH causes a bronzing of the skin or a buildup of melanin. Even a mild infection can lead to disease. In some cases, hyposecretion of aldosterone results in a loss of sodium and water. Cushing syndrome is oversecretion of glucocorticoids caused by tumors in either the pituitary gland, resulting in excess ACTH secretion, or the adrenal cortex itself. The most common cause is taking glucocorticoids to treat other conditions, to suppress chronic inflammation. Excess glucocorticoids can cause muscle protein to be broken down and fat to be deposited in the midsection. Excess production of adrenal male sex hormones in women may result in masculinization, that is, increase in body hair, deepening of the voice, and beard growth. Treatment is a reduction in the amount of cortisone being taken, cortisol inhibiting drugs, or surgery to remove the tumor. Okay, so moving on to the pancreas. So the learning outcomes here are to explain why the pancreas is both an endocrine and exocrine gland, list the hormones produced by the pancreas and provide a function for each, describe how the pancreatic hormones help maintain blood glucose homeostasis, and distinguish between type 1 and type 2 diabetes mellitus. So the pancreas is behind the stomach near the duodenum. It's both exocrine and endocrine. Exocrine tissues secrete digestive enzymes. The endocrine tissues is called pancreatic islets that contain a variety of cell types with A cells, which secrete glucagon, B cells, which secrete insulin, and D cells that secrete somatostatin and regulates the digestive process. Insulin is unlike most other endocrine organs. The pancreas is not under pituitary control. It responds directly to changes in blood glucose levels. It's secreted when blood glucose levels are high, such as after eating, and stimulates the uptake of glucose by cells, especially liver cells, muscle cells, and adipose cells. In these ways, insulin lowers blood glucose levels. Okay, so insulin, liver stores glucose from blood as glycogen. Muscle cells store glycogen and build protein. Adipose tissue uses glucose from blood to form fat, and this lowers glucose levels. Okay, so glucagon is secreted when blood glucose levels are low, like between meals, and stimulates the liver to break down glycogen to glucose. It also promotes the use of fat and protein in preference to glucose as energy sources. Adipose cells break down fat to glycerol and fatty acids. The liver takes these up and uses them to make glucose. And these ways, glucagon raises the blood glucose levels. Okay, so glucagon is secreted. Adipose tissue break down fat. Liver breaks down glycogen to glucose. Glucose enters the blood, and blood glucose levels rise. Diabetes mellitus, an excess of glucose in the blood. As blood glucose levels rise, glucose along with water is excreted in the urine. Diabetics urinate frequently and are always thirsty. Other symptoms include fatigue, constant hunger, and weight loss. The high blood glucose levels often cause an increase in blood pressure due to osmosis and can cause damage to the small capillaries of the kidneys and the eyes. Diabetics often experience vision problems due to diabetic retinopathy and swelling in the limbs. If untreated, often develop serious and even fatal complications. Sores that don't help or sores that don't heal develop into severe infections. Blood vessel damage cause kidney failure, nerve destruction, heart attack, or stroke. And there's two types of diabetes. We have type 1 and type 2. Type 1 is sometimes called juvenile diabetes or insulin-dependent diabetes mellitus. Type 2 is also known as adult onset diabetes or non-insulin dependent diabetes mellitus. Although the cause of these forms of diabetes are different, they can occur in children or adults. So type 1 diabetes, the pancreas does not produce enough insulin, caused by exposure to an environmental agent, most likely a virus. Autoimmune responses destroy the pancreatic islets. The body metabolizes fat, which leads to the buildup of ketones in the blood, called ketoacidosis. Increases acidity of the blood can lead to coma or death. Type 1 diabetics must inject insulin daily. Blood sugar level may swing between hypoglycemia, which is low blood glucose, and hyperglycemia, which is high blood glucose. Symptoms of both: perspiration, pale skin, shallow breathing, and anxiety. If the problem is hypoglycemia, the treatment is ingesting sugar. If the problem is hyperglycemia, the treatment is insulin. Type 2 diabetes. Most adult diabetics have type 2 diabetes. Patient is often overweight or obese. Adipose tissue produces a substance that impairs insulin receptor function. Occurs most often in certain families or even ethnic groups. So 77% more common in African Americans than in non-Hispanic whites. Cells are insulin resistant. They can prevent or at least control type 2 diabetes by adhering to a special diet and exercising regularly. If this fails, oral drugs can help. Millions of Americans may have type 2 diabetes without knowing. The effects of untreated type 2 diabetes are as serious as those of type 1. So testing for diabetes, oral glucose tolerance test for diabetes. After the patient ingests glucose, blood glucose concentration is measured at intervals. In a diabetic, blood glucose levels rise greatly and remain elevated for several hours, and glucose appears in the urine. In a non-diabetic person, the blood glucose level rises somewhat and then returns to normal after about 2 hours. And that's shown here, so this increase in glucose in the urine. Okay, so other endocrine glands. So your learning outcomes are to list the hormones produced by the sex organs, thymus and pineal gland, and provide a function for each. List the hormones that are produced by glands and organs outside of the endocrine system. So other endocrine glands, the gonads, the male testes, and the female ovaries. These produce hormones and therefore are considered endocrine glands. In addition, there's the thymus and the pineal gland, as well as some other tissues in the body have endocrine functions. So the testes and ovaries are controlled by the hypothalamus and pituitary. The testes are located in the scrotum, and the ovaries are located in the pelvic cavity. The testes produce androgens, male sex hormones such as testosterone. The ovaries produce estrogen and progesterone, which are the female sex hormones. Testes and ovary, testosterone, and estrogen and progesterone feed back to control the hypothalamic secretion of gonadotropin releasing hormone. Okay, so estrogen and progesterone stimulate the female secondary sex characteristics and maturation of eggs. Testosterone stimulates the male secondary sex characteristics and maturation of sperm. Because of the gonadotropic hormones, the testes begin to release increased amounts of testosterone, starting at puberty. Testosterone stimulates the growth of the penis and the testes. It also brings about male secondary sex characteristics, such as facial and axillary and pubic hair. Larynx and vocal cords enlarge to deepen the voice. Stimulates oil and sweat glands that can cause acne and body odor, and can cause baldness. So anabolic steroids are made of testosterone. Effects of estrogen and progesterone. Estrogen secreted at puberty stimulates the growth of the uterus and the vagina. Estrogen is necessary for egg maturation. Female secondary sex characteristics, body hair and fat distribution, more fat under the skin. The pelvic girdle is wider, breasts, and monthly menstruation. So the thymus is beneath the sternum, reaches its largest size and is most active during childhood. With aging, the organ gets smaller and becomes fatty. So thymosins cause lymphocytes to mature. As lymphocytes from the bone marrow pass through the thymus, they are transferred into T lymphocytes. So the pineal gland is in the brain and produces melatonin primarily at night, regulates daily sleep-wake cycle. We get sleepy at night when melatonin levels increase and awaken once daylight returns and melatonin levels are low. So we all have a circadian rhythm, which is a daily 24-hour cycle controlled by the hypothalamus. And this also regulates sex development. Okay, so melatonin production changes by the season. So hormones from other organs or tissues. We have EPO, which is secreted by the kidneys in response to a low oxygen blood level and stimulates red blood cell formation in the red bone marrow. Many organs and cells produce peptide growth factors, which stimulate cell division. Some are released into the blood, others diffuse to nearby cells. We have leptin, which is produced by adipose tissue and acts on the hypothalamus. It signals fullness. Obese people may have plenty, but it may be defective or they may not have enough receptors. Okay, we have prostaglandins, which are made from a fatty acid, not distributed in the blood. They act locally, are produced by damaged tissues, cause pain, and the uterus causes muscles to contract, causing cramps. It helps causes fevers, reduce gastric secretion, so treat gastric reflux. We have lower blood pressure, so treat hypertension, inhibit platelet aggregation to prevent thrombosis. Okay, so hormones and homeostasis. So your learning outcomes are to summarize how the endocrine and nervous systems respond to external changes in the body, summarize how the endocrine and nervous system responds to internal changes in the body. Okay, so controlling the reproductive system. The reproductive system can't function without nervous and endocrine control. The hypothalamus controls the interior pituitary, which controls the hormones of the testes and the ovaries and the production of their gametes. The nervous system controls the muscular contraction of the ducts that propel sperm, also controls muscular contractions in the female reproductive system. Without the positive feedback cycle involving oxytocin, birth might not occur. So the neuroendocrine system is a combination of the two systems. We have the hypothalamus, which bridges the regulatory activities of the nervous and endocrine systems. The hypothalamus also acts on the nerves of the autonomic system. The hypothalamus belongs to both the nervous and endocrine system and is referred to as a neuroendocrine organ. Okay, so that'll be it for today's lecture. Were there any questions before we conclude? All right, sounds good, guys. I'll catch you later.